Hi, this is a presentation by Nathan Lindy, Mary Milne, Caitlin Stanger, Jenna Rodriguez, and Abby Kofed, and we will be discussing workplace hazards and violence in the nursing field.
In the workplace, nurses often experience common injuries from day to day. Most of these injuries are a result from overexertion. In 2016 alone, there was 19,790 non-fatal injuries. For example, when a nurse is bending down often or lifting a lot of weight, such as a patient, this can result in injuries like joint or severe back pain. Other injuries in the workplace may be from slipping, tripping over cords, or on the wet floor. It's important for nurses to be aware of their surroundings. To avoid overexertion injuries, nurses should use transfer or lift belts to move patients if available or get help from other nurses.
Take a moment to imagine someone with an infectious disease. It is very likely that you're picturing them in a healthcare facility. This puts the faculty at an increased risk of not only contracting that disease but spreading it. One study found that a nurse's annual exposure with such diseases and illnesses is within 10 and 44% of all the contact that they make throughout their days. An example of an infectious disease can be something as serious as MRSA, a drug-resistant bacteria, or as common as a cold. They're dangerous because they're easily spread, symptoms are not always recognized early on, and with workforce demands, people still attend work feeling ill. It's important that we take precautions such as using PPE or personal protective equipment, hand washing, covering your mouth and nose when you sneeze or cough, and not going to school or work when you're feeling sick.
Many different studies have reported that nurses in the workplace are often exposed to hazardous chemicals and other types of exposures in the forms of drugs, cytotoxic drugs, and things like ethylene oxide, halothane, nitrous oxide, formaldehyde, and glutaraldehyde. These chemicals are often found in things like anesthetic gases and also materials that are used to sterilize medical instruments. While it's important to sterilize these instruments and make sure that there are no germs and infections that are present, we need to make sure that nurses are safe. These chemicals can cause eye and skin irritation, allergic reactions, labor breathing, chemical burns, and a lot more. Nurses are also exposed to things like ionizing radiation while helping patients who are undergoing radiographs and those who are undergoing chemotherapy. This can increase the risk of stillbirths, miscarriages, and other types of cancers. Portable x-rays can also cause unexpected radiation exposure.
Abuse and harassment in the medical field happens more frequently than you think. These actions are never to be tolerated in the workplace, especially as you are giving care to a patient. Nurses need to know the distance they should keep between patients to avoid any inappropriate actions. Abuse and harassment can happen from both the healthcare provider and patient. Patients will sexually harass their nurse by inappropriate touching, verbally abuse, and be physically violent while being treated. A patient will act up this way because they are often scared and stressed in their new environment. Nurses can abuse the patient sexually or verbally as well. One thing that is seen, especially in nursing homes, is neglect, which is failing to provide appropriate and sufficient care to the patient. If any of these actions are present in the workforce, make sure to report it.
Stress and mental health. The number one health concern reported by nurses was stress and overwork. This was reported by 74% of respondents of an American Nursing Association survey in 2013. A particular concern for nurses was working with terminal patients, nurses who work 12-hour shifts, and nurses who work overtime often. Because of overwork and stress, nurses' mental health can easily deteriorate. Nurses typically experience depression at twice the rate of the average citizen, meaning about 1 in 5 nurses experience depression compared to 1 in 10 average individuals. Physical side effects often result as well, causing headaches, fatigue, gastrointestinal distress, or back and neck pain. In nursing, it is helpful to stay organized, take care of your body, be positive, and talk about how you feel to combat the negative effects of workplace stress.